about that. You also got choked up when you started reading the statement about his petition. I know that people, when they watch the Undercover, they have certain milestones. Since Friday, can you kind of give some of the milestones that you've seen emotionally and
When we first talked via the teleconference, he was very pale. His eyes were red. He did not have a lot of energy. It was really just more that he wanted to see my face. This was Saturday, so, and I was happy to see his face. And you know, later on in the evening, the second teleconference, he says, "You talk," because he didn't even have the energy to say anything. But every single day, you know, the first 2 or 3 days, he was very slow to respond, slow to get his words together, to say something. He was quite emotional. I would tell him things that happened, you know, things that people were saying, and he would get pretty, you know, emotional about it. Then, I mean, as Dr. Smith said to me this morning, it seems like his brain is waking up a little bit more every day because, you know, even they could see, I think it was, let's see, today is Thursday. So Tuesday, they said he was sharing all his notes with them to tell, you know, talking about the course of the disease. And this morning when I talked to him, I would say he was mentally like 80%, just really, you know, much more his usual self, especially in that sort of Skyping context. You know, it's always a little awkward and strange. So, right, I think their main goal right now is to get him to eat more. He he's had a lot of, some of it has been stomach upset, but more of it has just been things taste funny or the texture is funny. So, so the goal really in the next couple of days, I think, is to get him to find things he can eat so that he is eating more normally and get some calories. So.
You said earlier in the week, or you reported earlier in the week, saying that he had a rough reaction to that experimental drug, and then it's gotten better since then.
Yeah, I think it's fair to say the first, he was sicker, so it's hard to know for sure what was responsible. And he had electrolyte abnormalities, fluid problems, and that's the time we were administering his medication. So it's hard to know what caused what, but he seemed to be tolerating each dose subsequently better, and he lately has had no reaction to it.
Every day?
We're giving it to him, yes, roughly.
The blood treatment that was given one time?
There was two separate occasions, Dr. Brantley's blood.
What did that do? What affected that?
Oh, it had no effect. It was like he was eating chicken soup.
As far as disease,
Well, I think we're hoping it jump-started his immunity. So this is a very serious viral infection, and to survive, you have to build up enough antibodies to neutralize the virus. And since most people don't survive, the virus multiplies faster than the immune system can respond. But we're hoping to buy him some time, and in other words, give antibodies to help his immune system get started battling the Ebola virus and let him get ahead of the curve. So there again, he seemed to respond nicely to those and certainly tolerated them. I don't know how much of his recovery is due to the drug, how much is due to the convalescent serum, and how much is due to aggressive IV fluids and other medications to help him. Certainly we want to thank the critical care medicine anesthesia team was spectacular with taking care of a very sick person.
We do have some folks listening in on the phone, and we'd like to turn things over to them if they would like to pose any questions. So feel free to do so now. If they can hear us.
This is Michelle Cortez from Bloomberg. I'm wondering if you guys could identify yourselves first and then tell us what the treatment effect or what the treatment has been. We're kind of getting some crunchy information through the phone. We can't hear it exactly. It sounds like maybe some blood transfusions from Dr. Brantley and then an experimental medication, wondering how often he got that and what type of fluids and whatnot. Thanks.
So this is Dr. Angela Hewlett. I can tell you that he received 2 doses of convalescent sera from Dr. Kent Brantley. He's received an experimental drug every night, actually, for the last several days since his arrival. And he's also been receiving a lot of what we call aggressive supportive care, and that is IV fluids, nutrition, supplements for his electrolytes in his blood, things like potassium, phosphorus, things like that that are important to maintain the sort of integral functions of the body, cardiac function and such. And essentially what we've been doing now is just supporting him through this.
As a follow-up to that, what signs will they be looking for to decide whether or not to have Dr. Brantley back to add another treatment? And as a follow-up, also the medical treatment, I guess prior to experimental drugs.
Well, I'll take that. This is Dr. Phil Smith. First of all, the milestones are clinical, laboratory, and others. So, for instance, we're hoping to have data back from the CDC on how much Ebola virus he had in his blood at certain times through his hospitalization, and that'll help us. And seeing how he does clinically. And as I mentioned, I've been asked not to disclose by several parties, not to disclose the drug, I think, for a variety of reasons. One is that we don't have the data yet. There is very little short supply. We don't want them to create a feeling that this is a cure-all. We don't know whether this drug had any impact at all. It might have. He certainly got better, but he got plasma. He got aggressive resuscitation. So we think it'd be premature to speculate about what the drug is and what its effect was.
Could you talk a little bit about the effort to document the treatment and get data? And, so you're in new territory, and what are you doing to figure out if any of this helps and maybe help future patients?
Well, that's a good question. These new drugs all have rigid protocols that the FDA enforces, and so they all have require extensive testing of blood parameters so we can see, for instance, if any kidneys are injured or liver is injured or there's anemia or any side effects. We're also measuring the amount of virus in the blood and other tests like that, biological markers that will help us decide whether it was effective or not.
But it sounds like it'll be difficult to tell of the treatments you're doing which had an effect or how much of an effect was from the blood transfusions or from the drug or from the other care you're providing.
That's legitimate criticism, but we decided we're more interested in saving Rick than trying to have a pure study, so we just administered everything we had access to, basically. And we're hoping that our experience plus the Emory experience with ZMAP will begin to pool enough information that we can start to get an idea about which drugs could be effective.
Doctors, how much longer is this line of treatment going to continue?
We're reassessing that on a daily basis, and it's really going to depend on his progress. Right now, we're encouraged by his progress, and as you've heard from Debbie and Dr. Smith, that he is doing a lot better clinically and on paper in his lab work and lab parameters. But again, we're really taking things day by day here, and I think that this is, as I said, sort of a brave new world, and he is his own patient and different from all the others, and so we really have to assess on a daily basis on our various therapies, including the investigational drug.
You need to